through the strategy that we've got, and I just patented last year, I patented our PL 2020. And the reason that that's different is that I found that most of the devices out there, and some are coming from Germany, which are fairly effective. But if you look at the history of UV lights on plastic, it's not good. They even tell you, some scientists have studied if you leave the water bottle in the car and the sun hits it, don't drink that water because it could cause cancer. So we don't want to cause issues. We want to, rectify the body and get that cleansed as much as we can. And so that's how we put the PL 2020 in place. We have nothing touching the lights but the glass. That was the other patent that I've done, is a nice, clear, flat, sterilized, sterile crystal cuvette. And we're very particular on the materials that the light, because the penetration is one of the major things that we look at, the flow of the blood going through that and the penetration of the combination of ultraviolet lights hitting that. And when you do it the right way, you can feel that first treatment. And then we have compounded that by saying, okay, so we don't want to overload the procedure. If we do that, then you have the Herxheimers come into place. So there was a study in Germany where they did 7 dogs, and they did it every day. So they found out by killing the dogs, what happened is they overloaded it too much. There was too much excretion that couldn't be handled, and that's what killed the dogs. So I took a lot of the German studies, the Russian studies, the Japanese studies, and there were some American, but mostly American was anecdotal. And I'm being an engineer, I like looking at details. Show me the medical records, show me this and show me that. And that's why I flew around the country, because I actually data mined several different doctors' databases. We signed an agreement allowing us to look at their medical data that we weren't going to use it. It was all HIPAA compliant. And I took that data and databased it and started doing some manipulation of why did this work and why did it work on one person versus another person. And so that's when we got to our initial device. This is the one that's going to be a generic device used for everybody.